A very good afternoon to everyone. My name is Fahad Shahid, and we are live from Prime Medical, Prime Health page, and our YouTube channel, Prime. A very important session of the day today. As you can see on your screens, understanding migraine. It's not only headache; it's more than that. Obviously, we have a lot of people who are not able to get through the migraines, or not able to understand their headaches, were not able to understand what is the actual problem, or how they should really tackle the situation of migraine. So we are going to talk about migraine today, and as our topic says, it's going to be an understanding of the migraine. I have with me a very important and a special doctor, Dr. Ghulam Shabbir. Doctor, thank you very much for joining us today.
Thank you very much.
Dr. Ghulam is a specialist neurologist currently practicing in Prime Medical Center, Reef Mall, and in Jumeirah. Dr. Ghulam has an extensive experience of more than 20 years now, and he's also a member of European Board of Neurology, member of AANEM, an ex-consultant in Aga Khan University Hospital back in the country, Pakistan. Doctor, thank you very much for joining us today. Doctor, a very, very important topic. I'm sure you must be having a lot of people who would really come for medications, or just coming to you and asking for a solution for migraine. And a lot of people are there who want to actually get rid of it, but unfortunately they're not able to do it. What do you have to say on this, doctor? Let's start with this.
Thank you very much for your kind introduction. Prime Healthcare Group is always doing very nicely, and we do respect our patients. And because of the pandemic, we started the webinar series so that we can educate our patients and community through the webinars and webinars. Today's topic is migraine. It's quite interesting topic. Migraine is, by definition, a primary recurrent type of headaches. 13 to 15% of population is suffering from migraine worldwide. This is the United States figures. If you compare to other regions of the world, I think so it's almost the same. So this is a huge burden of migraine in the community. It's more common in the female gender than the male, with a ratio of 3:1. It's a disease of the teenage. Unfortunately, this is the age, is a productive age in any way, because people, students in the schools, in colleges, the youngsters after their education start their career. So this disease is disabling in this peak of their age. So there's a huge economical burden of this disease worldwide. Regarding the pathophysiology, how it occurs, there was long history of it. People initially were thinking it's a vascular only. Vascular mean it is coming from the dilatation and vasoconstriction of the blood vessels. Then, after extensive research, they found it's not vascular only. So they found some other things, like they have seen the transfer of pain and transfer of other things. And recently, they discovered one gene called calcitonin gene-related peptides, and they are playing a role in the migraine. So their thought process then changed, and now they are saying it's probably a neurovascular disorder. It's not a vascular of origin. If we will go to the origin of the pain, it's originating from one center in the brain called a trigeminal center, and it having connection with trigeminal cervical connections. Then it is giving the branches. The reason the pain we are feeling in the neck because of the cervical C1 and C2 involvement, then it's transferring, coming to the frontal head, and then eyes, and then the face. That is because of the branches of the trigeminal nerve, the afferent branches, and then afferent branches are going to the central brain called thalamus and other parts of the brain. So that will be more of medical discussion. We will not go in that. Regarding the causes, because the pathophysiology is not clearly established yet, but they did a lot of work on that. So the genetic factor they noticed, and also environmental factors for the cause of the migraine headaches. So because of the gene, as I mentioned, as well as they have seen chromosome 19 and chromosome 1 and 2. That is one of the variant called hemiplegic migraine, familial hemiplegic migraine. Then the studies on the twins, and then the other environmental factors, and probably the cause is genetic factors and environmental factors. The triggering factors are important to understand, because this is the part of management for migraine we'll discuss later on. The triggering factors worldwide, people have seen stress, bright lights, flickering lights, escaping of meals, hunger, thirst, smoking, red wine, lack of sleep, lack of water in the body, and a lot of other things. Now, regarding the clinical presentation of migraine, the clinical presentation of migraine is very important to understand, because after the understanding of this, we will be able to differentiate the migraine from the other type of headaches. The migraine is typically, there are typical migraine, then there is classical migraine. The migraine symptoms will be hemicranium headaches, means headache in the half of the head. It may be bilateral, but mostly it's half of the head. The duration of headache is important to differentiate from other headache syndromes. The duration is usually from 4 hours to 3 days. Then associated symptoms are important, like nausea, vomiting, photophobia, we mean irritation of light, and phonophobia, we mean irritation from the sound. That's important component in the diagnosis of migraine. Then out of these two important, we need two other symptoms to fulfill the criteria of migraine diagnosis as per the International Headache Society. That is, one is it is the unilaterality of the headache, severity of the headache, moderate to severe, and then it's the throbbing type of headache, means it will pulsatile. It's something hitting, hammering the head. So this is good for the migraine without aura, and then the migraine with aura having its own diagnostic criteria. Now, if we will classify the migraine, migraine is broadly classified into migraine without aura, the most common type, 80% of population, and then the migraine with aura, that is almost 20% of the population, which is less common but more hampering than the migraine with aura. Then there are variants of migraine, which is very important to understand. One variant we mentioned, that is familial hemiplegic migraine, strong correlation with the gene chromosome 19, and there are three types of it: chromosome 1 and chromosome 2 as well. And then the ophthalmologic migraine. Ophthalmology means eye. Ophthalmologic migraine is involving majorly one nerve called trigeminal nerve. During acute attacks of patient, and their third nerve palsy will be there, that is reversible, and there will be ptosis of the eye drooping of the upper eyelid, and the muse is the eye may become small in size. Then the retinal migraine, which is different than this one, and this is because of the retina of the eye, the blood vessels they constrict, and there will be less of blood supply, and then people having visual symptoms for that. Then abdominal migraine, another type of migraine, very rare, very challenging to diagnose. And also the symptoms of migraine regarding the onset of symptoms. It is categorized in four categories: prodrome. There's a stage around more than 72 hours or 3 days before the starting of migraine. They have some sort of feeling of tiredness, fatigability, carving of certain foods. Then the stage of aura will come. The stage of aura is usually before starting the headaches. The aura may be different. The aura may be visual aura, which is very important to understand. People have maybe scotomas in front of eyes. They have zigzag lines in front of the eyes. People have interestingly seen that if they will eat one side of the plate, they will not eat the other side of the plate food. So they have seen the patient not able to see the half of the plate. Quite interesting studies. It is visual sometimes is very devastating if you have a take and you are driving. That may be catastrophic. Then the sensory aura, people having tingling sensations, sometimes half of the face, sometimes the neck, frontal head. And then the motor aura is again important. Motor aura, people will feel some sort of weakness in the muscles in the half of the body. Regarding important variant of vertebrobasilar migraine, which is very important, in which there will be symptoms of dizziness, difficulty in walking, balance problem. They will see sometimes double images. Make sure aura is reversible focal neurological symptom. If it will not reversible, then it will lead to other things, stroke. Now then there's a headache, the typical headache patterns which I discussed, throbbing, unilateral, 4 hours, associations which we discussed, and then there is a prodrome, postdrome phase of the migraine in which there will be a feeling of sleepiness, few people will be in a euphoric phase. Regarding the pattern of migraine headaches, there are four patterns people have seen worldwide. One is, first of all, one is that will episodic, progressive, it will finish. Another one is episodic, will get more and then finish. Another one, episodic, it will remain constant for longer time. The worst type is the migraine sometimes will get worse with passage of time. Now, what are the investigations? Actually, a lot of diseases having no any diagnostic test worldwide. If any disease having no any diagnostic test worldwide, then there is a criteria called clinical criteria for the diagnosis, which I discussed earlier. Although we are doing MRI, sometimes if patient having red flags, what are the red flags in headaches, particularly migraine headaches? If the aura is not reversible, someone has visual, sensory, motor, which is not reversible. People having difficulty in walking, people having diplopia, people having new onset headaches at age of 50 plus, then the onset is very important. If headache onset is within seconds, probably it should not be migraine, because migraine is will give us the marching symptoms, not immediately. It will give then the focal neurological hemiplegia, facial deviation, people having seizures, people having fever. So this will indicate us this is not only the migraine, it is beyond the migraine, then we should think about other things. Just like differential diagnosis, the things which will mimic with migraine is that cause the half of the head headache like migraine is the cluster type of headache. Cluster type of headaches will involve majorly the nose, eye, and half of the head. Cluster will come in clusters, 6 months, 1 year. It will happen. It will remain continuous for 1 week to 3 weeks. It's different than migraine because migraine is a recurrent type of headache. Then hemicrania continua, another type of headache, in which the headaches will be half of the head, but they will remain continue. Another type of headache, very important, called temporal arthritis, that is involve There is a artery here. You can see my finger. That is called superficial artery, temporal artery. Inflammation in that artery will cause the half of the headaches, which is mostly seen in age 50 plus. Now, it is very important to differentiate. Why? Because 5% of migraine patient population may have migraine in the advanced age. Then people having sunk another type of hemicranium headaches. Then differentiate. It could be a subarachnoid hemorrhage. It could be a stroke. It could be a brain hemorrhage. It could be a meningitis, inflammation of the brain and layers of the brain because of the infection. Then another important headache, which is challenging to diagnose, is idiopathic intracranial hypertension, which is seen in obese individuals and taking oral contraceptive pills or other medicines as well, which is beyond the discussion of this topic. So we will go to the management of migraine. That's very important because pain management worldwide is challenging. So migraine treatment is very challenging worldwide. So the management depends upon the type of the migraine headaches, severity of the migraine headaches, as well as the associated symptoms of the migraine headaches. The treatment will be non-pharmacological treatment, pharmacological treatment, and then we have latest things in the migraine headache treatment, like use the devices. We will go one by one. So first we will go what we can avoid from the precipitants. This is the first our target to manage the migraine. We will educate our patients to avoid for the precipitant first. Few tips I can give you. Suppose you need a calm environment, means you should go in a calm place. You should be stressfully free atmosphere. You can have choose the temperature as per your body need. You can put some temperature, swabs over the head. Then the sleep. Sleep is very important because lack of sleep is one of the precipitating factors in migraine. Now, if you'll go to the sleep bed, you have to turn off your lights, bright lights, turn off the TV, turn off the fan because fan will create noise. So noise one will cause the pollution of sleep, so that will precipitate the migraine. Don't take your diaries and your homework at the bed. Just go bed for the sleep. Then food. Food is another important thing. People have seen a lot of precipitating factors food can cause. Usually cheese, chocolate, and dairy products, but make sure this is not for all patients because it's variable from patient to patient. So we have to look for our precipitants. It does not mean that any patient having one patient having precipitant factor cheese and other patient having should have cheese. No, may be different. We should not skip the meals. That's very important. And the regularity of timing of food is again important that we have to look for. We should do regular exercises. Regular exercise seen as helpful in the management of the migraine headaches. Now make sure if you read and you go through the Google, you will see that it's mentioned that the exercise will precipitate the migraine headaches. That's true, but it's only when you have headaches. If you have headaches, at that time you should not go for exercise. You should confine to one place, avoid from the bright lights at that time. But overall, if you don't have headaches at that time, regular exercise definitely will be helpful for the migraine headaches. Then avoid from the stressors. Stressful conditions you should avoid. Try to do relaxing methods. Then we'll come to the treatment, the medicine. The medicine is divided into acute management. When you have headaches, you will take at that time called symptomatic treatment, and then the prophylactic treatment to prevent the migraine headache severity. So There are a lot of medicines being given, being approved for the symptomatic treatment of migraine, including acetaminophen, ibuprofen, then naproxen sodium. We have seen very good results with our population in naproxen sodium. Ergotamines were being used, still being used, not much, replaced by another group of the medicine called tryptophan group. Now, for acute symptomatic relief, majority of the community is using the triptans. I will mention few names: zolmitriptan, somatriptan, nortriptan, and a lot of tryptophan groups, a lot of medicines. It depends upon their duration, which is favorable in which condition. Then people having prophylactic treatment. Prophylactic treatment, there are class A medicines and class B medicines, class C medicines. Now, as per the FDA from USA, the class A medicines in beta blockers, that is propranolol, we usually give Indral to our patients. This is class A drug. Now we have to see the side effects. It's not good for the patient who having asthmatic. It's not good for the patients who having low blood pressure. It's not good for the patients having any cardiac means the rhythm problem. Means if their heart rate is already low, we should avoid from Indral, but it's class A drug. Then some anti-epileptic medicines being given for epilepsy, but can be given for the migraine prophylactic. This is very important to know, and we have to educate our patients that this medicine is not only for the epilepsy, for the fits, but this can be given in migraine headaches because their education is very important. Class 1A medicine, FDA, is sodium valproate. Sodium valproate, and another class A medicine is topiramate, that's Topamix. Now, because a migraine is common in the females, in the young age, in the childbearing age, so sodium valproate may not be a good choice for them because it will cause some problem during the pregnancy in the fetus because it will cause fetal abnormalities, malformations. So topiramate is even not safe in pregnancy, but it's a better option than the sodium valproate. Make sure all these medicines are contraindicated in pregnancy. Topiramate having very good results. Now, side effect of topiramate is it will cause means loss of weight, and people may have sometimes renal stones, and patient can sometimes some numbness and tingling sensation, dizziness. So we wisely titrate the dose, build up dose slowly, gradually in these patients. Other than this, people have seen magnesium supplement. Nowadays, people are giving very good results for that. The era of calcitonin gene is being replacing all the other medicines. It's coming and making its room, its space now in the migraine management. And we are also giving this CGRP, that is calcitonin related gene peptides, which have seen high in the patients with migraines. So it's recently FDA approved two medicines for that. Fortunately, we have one here in Dubai, and I have few patients. They are taking it. It is being given monthly. It's a pre-fill. Pre-fill. It's auto injector, and we are giving monthly basis. The target is to minimize the frequency of headaches, to minimize the need of medicine, to avoid from the side effect of medicine. The other alternative therapies, that is very important. We are giving Botox. Botox is approved by the FDA for the chronic migraine headaches or the migraine which is very intractable, not responding to other medicines. then we have to give Botox injection in triggering areas of the brain. Then other therapies like something called greater auricular nerve. That is, if you'll see, it's here in the back of the ear. So we are blocking it, we are giving injection there, and a lot of people are responding with that. Then there is massage therapy. Then there is transmagnetic therapy. We have to put some electrodes here, and magnetic waves will give comfort to the half of that. That's very important as well. Then people have vagus nerve stimulation. There is handled instrument you will put here in vagus nerve, and just that will help you out for the migraine. Then people are doing acupuncture for it, helpful in all the type of pain, but it is also helpful in chronic intractable migraine headaches. Then people are using nowadays yoga. Yoga have been seen is helping the people with intractable headaches. Now, one thing is more chronic migraine, very important to understand, and medicine overuse headache. What is the definition of medicine overuse headache? If a patient needs more than 15 days in a month for consecutive 3 months, regular medicine, analgesics, including opioids, non-steroidal anti-inflammatories, triptans, then this is called medicine overuse headache. Make sure we should not use medicines a lot for migraine because it will turn to chronic migraine, it will turn to medicine overuse headache or analgesic induced headaches. It's a big dilemma. It's very difficult to treat the medicine overuse headache. That if someone having medicine overuse headaches, then it's challenging for us how to treat it. The important thing is we should have very strong bond with our patient. We have to educate them, and then we have to tell them that you should not take this medicine. You should not. They will say we are suffering from headaches. Then we have to add some alternative therapy, just like I mentioned acupuncture, just I mentioned some massage therapy, transcranial magnetic therapy. We can give Botox in such type of patients. At least they should not take the analgesics regularly. Once they will get rid from that, and then they will be comfortable. Now, another topic is migraine and female, because it's more common in females. It having a strong relationship being seen in estrogen hormone. People, females in menarche, premenopause, and during the menstrual cycles, the three peak timing that people having migraine headaches. This is because of fluctuation of hormonal levels. Then, luckily, in pregnancy, people have seen there is a decrease, remission of the migraine headaches. This is because estrogen levels are coming down during the pregnancy. The menstrual migraine, catamenial migraine, we can say, is also very challenging. So that should be treated properly. Then we have to give either naproxen, acetaminophen, or there is one type of triptan that should be given before 2 days, during and after 2 days of the cycles. That will work actually. Now, pediatric migraine, that is important to discuss. The migraine is also seen in pediatric age group. There's no any age limit, but 7 age onward is the most peak age for the patients in pediatric age group. Then they have some symptoms. So hemiplegic migraine we have seen in patients pediatric. It's very misery for their parents because they are saying that our child having a stroke. Then we have to carefully evaluate such type of patients, and then we have to tell them that it's not a stroke. This is the type of migraine in pediatric. So brufen is a better option in treating the pediatric age group migraine. If someone has regular headaches, we can go for the Prophylactic treatment, people are saying paracetamol, acetaminophen may not work better than the brufen. So brufen is the drug of choice in such type of patients. Then the complication of migraine, as we mentioned, it's beyond the headaches. Complication, migraine, as I mentioned, the retinal migraine during driving, it can cause catastrophe. People very may have seizures, and it have been seen. It has been seen very rarely can cause ischemic strokes. There's an interesting thing we have noticed. There is called migraine stupor. Migraine stupor is type of vertebrobasilar migraine in which patient will have symptoms of vertigo, dizziness, drowsiness, and they become unconscious. They will go in coma. Then people are doing a lot of investigations. If you do each and everything, will be normal, including the lumbar puncture. But the lumbar puncture may show some lymphocyte white blood type of white blood cells may increase in those patients. It's a quite huge topic actually. It's a syndrome because more than millions of people, billion of people are suffering from headache and migraine. It's quite challenging. I will welcome your questions and thank you very much for listening today.
Thank you very much, Doctor. That was a very detailed explanation that you have made. Actually, I believe a lot of people who wanted to ask questions, you would have answered their questions. I've got some questions here. We would really take quick answers from you on those
Sure,
questions.
sure.
I've got a question here from Miss America, and she's asking: is migraine hereditary? Because there are three sisters, all the siblings, all of them are teenagers, and they have that.
Migraine, yes, that's a very important question. As we mentioned, migraine is a genetic disorder as well. So it may run in the families. Regarding all families or not, I think so. It depends upon if twins in the monozygote in the single womb, all will be involved. If the twins not in the single womb, means dizygote, then it may or may not be.
Great, thank you. Another question here by Ms. Sabah Sohail. She's asking, should I continue Topamax? Already taken 3 months, and when I stop, I got migraine again every 3 days. During taking medicine, the interval of migraine was better. I got half headache with eye and back head pain.
Actually, that asthma having a very intractable migraine headaches. The duration is variable. People are saying 6 months to 1 year. The Topamix should be taken, and after that, we have to decide whether there is a remission in the headaches or not. If not, then I think so. We have to go for the alternative therapies for that replacement.
Understood. Thank you. Doctor, one side headache and nerve pain, which medicine we need to take, doctor?
That is actually one side headache. It could be anything, including migraine. And the nerve pain, now a trigeminal nerve, trigeminal nerve, another type of headache. So the treatment is different for migraine and treatment is different for trigeminal nerve headaches. So I think so. First of all, we have to establish the diagnosis, whether patient having migraine or patient having trigeminal neuralgia. Then we can advise properly.
Thank you, Doctor. Doctor, there were some questions that came pre-session. I would really like to ask those questions to you because the people who have registered with us have asked, and probably they'll be watching us at this time. Doctor, I've got a first question here. How do we know if the headache is because of migraine or anything serious?
That's important question. That is important question really, because migraine having a criteria, clinical criteria, as we discussed, we have to consider the age of the patient, we have to consider the onset of headache, and we have to consider duration of headache. We have to consider the association factors in the headache. Now, just briefly, I will tell you what are the red flags. Red flags in the migraine headache: age. If someone has age 50, then we have to consider this a red flag. We have to investigate beyond migraine. If the onset of headache is within seconds, then this may not be migraine. It could be something called thunder headaches. We call it subarachnoid hemorrhage. Should be investigated. A patient having fever, neck pain should be investigated for meningitis. If patient having seizures, headache, vision problem, decreased vision, should be investigated for the cortical venous thrombosis. That is some clot formation in the brain. If patient having short duration headaches, seconds, it's coming regularly, half of the head, half of the face, some triggering factors, then it could be trigeminal. It may not be migraine because the peculiarity of migraine headache should last more than 4 hours.
Okay. Doctor, a question here from Miss Maylene, and she's saying, can acupuncture reduce or lessen the migraine attack?
That's important question. As we mentioned, chronic migraine patients are medicine overuse migraine headaches, or medicine overuse, analgesic overuse headaches. Acupuncture is indicated, it will work. There is not much data about that, but it will definitely work because this is one of the type of alternative therapy. Now, you will understand the pain. Pain is, as I mentioned, challenging worldwide to manage because acupuncture being used for the muscle pains, neck pain, back pain, simultaneously can be used for the chronic pain like migraine.
Thank you. Another question from Ms. Chen Lin came, and she's saying, is it safe to take Zomig at least 6 tablets a month?
At least
6 tablets a month.
Zomig is a tryptophan group of medicine. It's a good medicine. It's a medicine of the young people. We usually avoid from the 40 plus age. We should avoid if patient having cardiac disease. We should avoid if patient having diabetes. We should avoid if patient having hypertension. We should avoid if patient having stroke or other vascular disease. Other than this, Zomig is a good medicine. We can take 6 tablets in a month, but I think the question should be maybe some typing error. It should be in a day, not in a month. So I think so we can take Zomig twice a day. If it's working, it will work. More than 2 tablets of Zomig in a day, third one will not work. It means we have to go to alternatives.
Thank you. Thank you very much. Doctor, another question from Ms. Margaret. She's saying, is it a lifetime disease? My eldest sister stopped having it just after she became menopausal.
We discussed the progression of the disease, the pattern of the disease in our talk. Migraine peak age is 15 and then teenage. Pre-menopause will be another peak in the females. And we have seen the decrement of migraine after the menopause. And also, it's important to know migraine may run in the 50 age plus people, 5% only. So it may be in the elderly, but after the menopause, there should be a decrement in the migraine headache. It may not be lifelong. Yes, in very rarely, 5% of population, it may be lifelong.
Thank you. Doctor, what is the youngest age diagnosed with migraine?
That is the infant, maybe 2 months or 3 months as per the literature. Although this is very challenging, how to diagnose them, but in the literature, they mention at 2 to 3 months baby they diagnose.
Thank you. Doctor, another question I have here from Rich Castro, pardon me for the wrong pronunciation. How about chiropractic? Is it also helpful for migraines?
Chiropractic, I have not seen much in the literature. Chiropractic is good for the cervical and back pains. Overall, generally talking about, not especially for migraine, chiropractic may work for any type of pain.
Thank you, doctor. I've got another question here, which was actually asked earlier. Doctor, alternative ways to cure migraine instead of being drug dependent.
Yeah, that should be a target of any physician. First of all, we have to educate our patient for non-pharmacological therapy. As I mentioned, we should avoid from the triggers. Our calm atmosphere, the diet, our sleeping pattern, our other habits, smoking, red wine intake, we should avoid. Then precipitating factors we should avoid. We should do regular exercises and we should avoid from the stresses. We should do some releasing methods. Then, as I mentioned, few people will put some sponge over the triggering points of the head. Acupuncture is another alternative therapy. Yes, we should try first non-pharmacological approach for that.
Thank you very much, doctor. Uh, Coming to another question, doctor. This can be stopped without a treatment. It is more or less of an answer to the previous, but if you can just add on, because Mr. Omar Malik, Farooq Malik have asked this question. Can it stop without treatment?
Farooq Malik Sahib, it depends upon the severity of the migraine. As I mentioned, one of the progression type of the disease is it will vanish away, it will finish with passage of time. It's possible.
It is possible. Thank you. Another question, Doctor, that has come earlier is, one is, doctor, having migraine already, but how to avoid having it?
Means they
Before it comes, we can avoid or look into something that would really not let it come, rather than bringing it down. Before only we could do those actions where we would not get migraine.
Actually, the clinical presentation of migraine progression we discussed in four parts. We said prodrome, we said aura, we said headache, and postdrome. So prodrome is the time when the because migraine patient having experience when they will feel that now headaches will come, maybe 12 hours before, 24 hours before, 72 hours they start yawning, they feel tired, they feel fatigued, they having craving for certain foods, they want to eat certain special foods. At that time we should avoid from the triggers and we should do rest, calm and quiet room, bright lights we should avoid. At that time, we should avoid from the exercises and we can aid some medicine, simple medicine. That is the time that we should act upon the headache. I hope if we will act upon the headache by that prodrome time, then headache may not occur.
Thank you, doctor. Doctor, is there any echo sound also sometimes that comes or you feel while having migraine? What do you have to say on that?
If they are saying we are hearing some sounds, echo sounds during migraine, migraine is a throbbing type of headache. You will feel the pulsation of artery, but sounds are very unlikely. Yes, there is aura called auditory aura. People may have hearing of sounds, but that should be differentiated from hallucinations.
Thank you. Miss Sabha is asking, sometime I feel numbness in my jaw with my ear area. In my, when I got too much headache, should I be concerned about it?
Actually, during the aura period, which is called sensory aura, it will give positive symptoms. Positive symptoms, we mean it will give tingling sensation, some pinprick-like sensation. It's very unlikely it will cause numbness. Now, in post-drome, people may feel numbness. If someone having irreversible numbness over these reasons, that should be investigated.
Thank you, doctor. I have another question from Miss Aishani, and she's saying, is Panadol migraine recommended for long-term usage to deal with migraines? Or should I look at other long-term medicines?
As we mentioned, definitely migraine is one of the terrible type of headaches. So people need medicine. We should avoid from the overuse of medicine. So better to not take more than 10 times a month, because if we will take more than 10 times a month, it means we are overusing the analgesics. Then it is very difficult to treat the migraine. We can go for alternative, we can go for prophylactic therapy, but migraine, panadol migraine, people are giving for migraine. It is working for some patients, it may not for others.
Absolutely. Thank you, doctor. Doctor, a question. How much stress has to do with the migraine?
Stress is a very important precipitating factor for migraine. It's well known stress will precipitate. Now we are in the pandemic more than 1 year. I have seen surge of migraine patients in my clinic. Few factors: stress, financial issues, job losses, inactivity because of quarantine and going outside uh, for the precautionary purposes. So we have a lot of people they are coming migraine in the pandemic.
Understood. Absolutely. Thank you. Thank you very much, doctor. Doctor, as we're moving towards the end of the session, a lot of information has been given to you. I would really like you to give take-home message regards to the topic that we have covered, actually understanding migraine, so that we all can get
Thank you very much for all and relevant questions. We will be available anytime for our patients, for our audience, for the community to communicate with the topic anytime. We have system, time, email, on-calls, clinics, hospitals, everything. The take-home message is migraine is a very challenging type of headache. It will run in the families, having genetics, a well-known etiology. The understanding of pathophysiology is advanced, but is still not 100% clear. We should avoid from the precipitant factors. We should avoid from the overuse of medicines, particularly analgesics. We should avoid from from the stressful conditions in the life, and we should go with advice of the doctor. Doctor knows when to start the medicine, duration of medicine, patient needs symptomatic treatment, patient needs prophylactic treatment, patient needs beyond the treatment, which we discussed, the methodology of devices we discussed, Botox therapy we discussed about new methods, block of the post-ocular nerve, blockage of trigeminal nerve. We discussed about the massage therapy, acupuncture, and relaxation methods.
Thank you very much, doctor. It was a great session with you. A lot of questions have been answered. And of course, I'm sure about it. People who have this problem definitely would be looking forward to, go for the therapies that you've explained them. And I can understand what you have actually the main reason that the main explanation of yours would be, if you would agree that we should at least not try with the medications first for the migraine, right?
Sure, that's great. That's important.
Thank you, doctor. A lot of appreciations have come for you during
Thank
this
you very
session.
much. Thank you very much. Thank you very much.
Talk on this, and we really thank you to all of them. I would like to end up the session here. Just wanted to tell that if you need to book an appointment for Dr. Ghulam, he is available at Prime Medical Center, Reef Mall, and Dr. Ghulam is also available in Jumeirah. You can always book an appointment through mobile app that we have. You can see the Prime Health app, that is the app which is for Android and iOS, sliding in the bottom of the screen. You can download from Android or iOS stores, and you'll be able to book an appointment and see the doctor's details as per his availability. As Prime is all about personalized care personally, this is what we always want to spread out to the community, as Doctor rightly said, and to everyone out there. So, and definitely we will keep on doing it. Your recommendations are very, very important to us. Give us your feedback on this webinar and overall on our Google reviews, and of course on our Facebook page, which is named as Prime Health. We are live from which if you want to book an appointment through the call, then you are most welcome to do it at 047070999, and you can book appointment accordingly. So understanding migraine has been a very important topic today, and we have learned a lot from Dr. Ghulam. Once again, I would really like to thank Doctor for giving us time. And we shall be coming back to you with another topic very soon.
Sure.
Thank you very much.
I'll be happy.
Remember that Prime is always about personalized care personally. That's what we are doing. Take care.
Thank you. Bye.